Hi everyone, in this video I want to talk about some of the specifics related to birthing in the time of COVID-19. As the situation evolves, things can change rapidly, even day to day, and hospital policies can change daily. So I'm going to try and keep this video updated, but I wanted to let you know that we are thinking about you and sending you a lot of positive energy at Evidence-Based Birth for this birth. So one of the first things that is on top of a lot of people's minds is the possibility of not being allowed to bring a support person with you to the hospital. If that is your situation, my heart goes out to you. I know how anxiety-provoking that can be. So if that is the situation in your community, I want to give you a few tips for how you might handle it.
First of all, it can be helpful to understand where these policies are coming from. A big priority in fighting the pandemic is protecting hospital staff. One of the lessons that we've learned from Italy is that protecting healthcare workers must be a top priority. The latest figures show that healthcare workers make up nearly 1 in 10 of Italy's COVID-19 cases, and infected medical staff in China made up about 4% of the total cases. Healthcare workers are facing critical shortages of personal protective equipment. The high rate of infections among nurses and other healthcare staff is a serious concern because workers who become infected must stay away from work for at least 14 days, depleting the already exhausted workforce. The main way the virus spreads is person to person. The virus is in respiratory secretions and feces, or stool. A new study also found that the virus is stable on surfaces for up to several days. It's detectable in aerosols for up to 3 hours, up to 4 hours on copper, up to 24 hours on cardboard, and up to 2 to 3 days on plastic and stainless steel. This means that people may acquire the virus through the air and after touching contaminated objects. Half of all people who get infected will start showing symptoms by 5 days. The other half will take longer. However, most people who develop symptoms will do so within 12 days. It could be that people are most contagious when their symptoms are most severe, but scientists are becoming more and more concerned that people with no symptoms or mild illness could be driving the epidemic. One research study found that people with COVID-19, that some of them had high levels of the virus in throat swabs early in their illness when their symptoms were still very mild. The New England Journal of Medicine also reported an infected individual who never developed symptoms, but was shedding a similar amount of virus as those who did have symptoms. This is why so many governments are telling people to stay home and act as if they have the virus, because they just might, even though they don't have symptoms. So there's a lot of fear of contagion. Combine that with the lack of personal protective equipment and a critical shortage of testing supplies that we don't know who has the virus, and this leads to a lot of fear. Fear is a common component of pandemics. There's a lot of research in psychology about what happens when people are afraid. Psychologists have found that facts seem to matter less to people when their emotions take over. Emotions really affect how we perceive risk. Also, during a pandemic, people tend to lack trust in scientists and government officials. They also tend to have a higher perceived risk from rare events with severe outcomes than common events with less severe or delayed outcomes. People also tend to worry more over things we can't control. We can't control this infection. We don't know who has it, and so that creates a lot of fear. So this is what led us to the response of the medical system. In many places around the world, the default response of hospital administrators was to remove the doula from the room. Their next response was to create a policy in some places that removes the partner from the room. Unfortunately, these policies are made out of fear and not based on any evidence. They ignore the birthing person's human rights, and they ignore the short-staffed situation and the need for the birthing person to have physical and emotional care. Also, there's nothing in the CDC guidelines in the US that specifically bans partners from labor and delivery. So as of the time I'm recording this, these bans are not in line with CDC policy. Having a companion with you in labor is a human right. On March 18, in the midst of the pandemic, the World Health Organization affirmed that all pregnant women, including those with confirmed or suspected COVID-19 infections, have the right to high-quality care before, during, and after childbirth. This includes antenatal, newborn, postnatal, intrapartum, and mental health care. They also state that a safe and positive childbirth experience includes being treated with respect and dignity, having a companion of choice present during delivery, clear communication by maternity staff, appropriate pain relief strategies, mobility in labor where possible, and birth position of choice. They state that if COVID-19 is suspected or confirmed in a maternity care patient, healthcare workers should take all appropriate precautions to reduce risks of infection to themselves and others, including hand hygiene and appropriate use of protective clothing like gloves, gown, and medical mask. A Cochrane review of 26 randomized trials with more than 15,000 participants found that when you are able to have a companion with you present continuously during labor, you have a 25% lowering in the risk of cesarean, an 8% increase in the chance of having a spontaneous vaginal birth, a 10% decrease in the use of medications for pain, a 38% decrease in the baby's risk of having a low 5-minute APGAR score, a 31% decrease in the risk of being dissatisfied, and shorter labors by 41 minutes on average. With some of these outcomes, the situation was improved even more by specifically having the presence of a doula. For example, the presence of a doula lowered the risk of cesarean by 39%. We can flip these numbers and look at it from a different perspective, in the perspective of banning a companion. When you ban a companion, it leads to actual harm. An increase in the risk of cesarean by 25%, an 8% decrease in the likelihood of a spontaneous vaginal birth, a 10% increase in the use of medications for pain, a 38% increase in the baby's risk of having a low 5-minute APGAR score, a 31% increase in the risk of being dissatisfied, and longer labors by 41 minutes on average. The author of the 2017 Cochrane review that we were just talking about also did a review of all of the qualitative or interview research on continuous support during childbirth. They were trying to identify and describe the experiences of birthing people, their partners, healthcare workers, and other key stakeholders about labor companionship. They had high confidence in these findings from their review of the research. They found that some healthcare providers are still resistant to integrate companions into maternity services. And this might be why they were so quick to ban doulas and other companions in some parts of the world during the pandemic, because they were already resistant to their presence to begin with. They also found that companions play an important role in bearing witness to the childbirth experience. Companions provide valuable emotional support, physical support, and pain-relieving measures. Women want a caring, compassionate, trustworthy advocate in the room with them. And support from a companion led to a more positive birth experience, feeling safe, strong, confident, and secure. However, when we take away that companion and we combine it with potential staffing problems, this can create a huge problem for laboring people. Prior research has found that nurses only spend about 30% of a person's labor with them. When you have a pandemic, which leads to staffing shortages due to illness and having to quarantine staff, this means you have fewer nurses with less time to spend with you. Nurses may also be more reluctant to spend time in patients' rooms because they see every patient as somebody who could potentially have the virus. In the midst of this situation with short staffing, a prepared and supportive partner can provide emotional comfort, positioning, help going to the bathroom, physical comfort such as massage, and serve as an advocate when the birthing person needs help, such as in an emergency or when there are concerning symptoms that healthcare staff may be not paying close attention to. Taking away a support person or companion of choice means that a laboring person may spend the bulk of their labor alone. This is unsafe and a violation of someone's human rights. So if you are in a situation where hospitals are banning support people from labor and delivery, what can you do? Well, here are some options that I've seen other people doing. One thing that you could do is take action even before there's a ban in place. Hospital administrators might not have a ban right now, but that doesn't mean that they won't implement one if things get worse. So start petitioning your hospital now. Speak out to reporters. Make your concerns known. I see a lot of people switching to a freestanding birth center or home birth provider. If that's something you're interested in, you can set up conversations with those midwives. They can screen you to see if you would be appropriate for a birth outside of the hospital. Another option that some parents may choose is to not fight the ban on support people, but to labor at home for as long as possible and arrive at hospital only towards the end of labor. Some people I know of are even laboring in vans or cars in the hospital parking lot. This option has the benefit of being able to keep both your partner as well as a doula or another support person with you for most of your labor, but it also has the drawback in that you won't get medical attention for the longest part of your labor. This also means that you could not have the option of an epidural until very late in the process. I could also imagine a birthing person standing in labor on the sidewalk in front of the hospital and having very loud vocalizations with their contraction and refusing to go inside until they promise that their partner can stay with them. People really don't like watching someone being really loud in labor. It makes everybody uncomfortable. I've not known of anybody using this technique yet, but I would be curious to see if it would work. This may seem drastic, but in the 1960s and 1970s, when spouses and partners were not allowed in labor and delivery unit, one way that women and their partners would approach the problem was to handcuff themselves together. Another option would be to birth alone with virtual support from your doula and partner. I've read reports from Hong Kong and some other countries where women were forced to give birth alone. And some of them said that they didn't mind, that they understood why the rules were in place, and they were okay with following the rules. This may be easier for someone who's having a planned cesarean birth or someone who's planning on having an epidural, although it still would be difficult to not have your partner with you during the birth. No matter what, I highly recommend virtual support from a doula, and we do offer a virtual doula directory at Evidence-Based Birth. There are doulas, midwives, and nurses all over the world who are standing by ready to help you navigate the system and this problem. Virtual support from a doula and partner might look like text messaging, having them on speakerphone, maybe even having a laptop open in the room with Zoom video chat or another video chat program going, where both your doula and your partner can keep an eye on you and talk with healthcare staff as they enter and exit the room. Finally, another option is to ask for or demand early discharge, if all is well. Many hospitals are permitting women to go home earlier with their babies than usual because of the pandemic. So again, these are all options for expecting parents who are facing a ban on any support people during labor and delivery. Hopefully you will not have to face this situation, but if you do, it might be helpful just to know that there are options. Another option that I didn't put on here, but I've seen other people talking about in the news media, is switching hospitals. So maybe switching to a hospital that doesn't seem to be hit as hard by the pandemic, or maybe crossing state lines and giving birth at a hospital that seems to be in a better condition. This might take some advocacy work in reaching out to your insurance company and advocating that they cover that switch in care.
I also want to talk about staying home as long as possible. It's best practice if you're having an uncomplicated pregnancy and your labor starts on its own that you stay at home until active labor, which is about 6 centimeters. And for many people, that's defined as your contractions happening about every 4 minutes, and that this has been going on for an hour. Now, this definition may not work for everybody because everybody's labor is a little bit different. But it's important to make sure that you have comfort measures lined up at home that you can use to stay comfortable as long as possible at home. And let's talk about those comfort measures you can use when you get to the hospital, whether or not you're able to bring a support person with you.
In general, research has shown that when people go to the hospital too early, they are more likely to receive unnecessary interventions. On the other hand, people who are educated on how to spend their early labor at home have better outcomes and higher satisfaction than people who go to the hospital too early in labor. Because of the risks of early admission, most people are encouraged to spend early labor at home and wait until active labor to come to the hospital. The wonderful thing is there are a variety of comfort measures that you can use at home with your support person. Comfort measures are important for early labor because they lower pain and anxiety, shorten the length of your labor, and increase your satisfaction. The best results occur when you combine multiple methods of comfort, so try more than one method at a time. Here are some options for staying at home in early labor. You could listen to music, eat and drink, distract yourself by watching a movie or baking something. Get in the tub or shower. This is the perfect time to use your birth ball. To sit on it, roll your hips in circles or side to side, or get on your knees on the floor and drape your upper body over the birth ball. You can walk around or dance. There's lots of fun dance videos on YouTube that show how people dance during labor. You can have your doula with you if you have a doula. You can receive a massage. Your doula or your partner can put counter pressure on your tailbone or your lower sacrum if you're having any back discomfort. You can use deep breathing and relaxation methods. You can sleep in your own bed or take a nap on the couch. You can use meditation or mindfulness, and you can say affirmations out loud to yourself or have your partner say them to you. It can actually be quite enjoyable to stay at home in early labor. So if you're having a hospital birth, when is it time to go to the hospital? Talk with your labor support team about when it's time to go. They may have special suggestions for you due to your unique situation. including your preferences for pain management, whether or not you want medications, and how far away you live from the hospital. Some common signs that you should go to the hospital include, if this is your first baby, contractions occur every 4 minutes, last at least 60 seconds each, and this pattern has been going on for 1 hour. If you have given birth before, contractions occur every 5 to 7 minutes and last at least 45 seconds each. The shift from early to active labor can be dramatic and fast in people who have given birth before. So if you sense a significant change in your pattern, it's time to go. Other reasons to go to the hospital include severe pain or fatigue, fever, or your water has broken or your membranes have ruptured, or heavy vaginal bleeding. Again, talk with your support team and your provider about when to go to the hospital. For those of you who are worried that your support person might not be allowed to come with you to the hospital, I want to reassure you that there are lots of comfort measures that you can use with or without a partner. Some ways you can comfort yourself in the hospital include having your earbuds in and listening to your favorite music playlist, listening to guided relaxation recordings, using a birth ball or a peanut ball. Most hospitals have those. Using upright positions, bringing your own essential oils with you, packing your own snacks and drinks, vocalizing using lower, deeper sounds instead of high-pitched sounds during contractions. Self-hypnosis is a great option, and HypnoBabies has a fully online training in how to use self-hypnosis to lower your pain. Hypnobirthing also has a book you can read to learn more about it. Visualization, you can imagine yourself in your favorite place. You can ask for an epidural, or get in a tub, use meditation or mindfulness, or bring a TENS unit along. Attach the pads to your lower back and stimulate yourself to help increase your comfort. Finally, I want you to remember to have confidence in your body. Remember that your body knows what to do. Trust in the hormones that we talked about in the Hormones of Labor video. Let those hormones take over. Your baby knows how to be born and you know what to do. Also know that people can quickly bond during labor. Even if you don't know your labor support team ahead of time, that oxytocin is running high, and it can be high in both you and the staff caring for you, and you can quickly become fast friends. Also, remember that your ancestors before you have done this over and over again, including some of your more recent ancestors who may have had to birth alone in the early to mid-1900s. Also tell yourself you are strong, you are capable, you are safe. You can do this.
Another important thing that is important for you to understand as you're birthing in the pandemic is that this pandemic does not take away your human rights. So let's talk a little bit about what your human rights are during labor and what are your legal rights as well.
International organizations have put out documents talking about what your human rights are during pregnancy and labor. You have the right to be free from harm and ill treatment. This means you have the right to be free from physical abuse, including undergoing unnecessary episiotomies or things such as having stitches without anesthesia. Second, you have the right to information, informed consent and refusal, and respect for your choices and preferences, including the right to your choice of companion during maternity care. This means that no one can make you do anything or force you into anything without your knowledge or consent. You should have medical procedures explained to you in a language you understand and at a level you can understand so that you can knowingly consent or refuse a procedure. If you are feeling coerced or pressured into a medical procedure, such as pressure to have an induction or cesarean, this is a violation of your human right. Number 3 is that you have the right to privacy and confidentiality. This means you have the right to privacy during labor. You do not have to labor or deliver in view of others without privacy barriers. Fourth, you have the right to be treated with dignity and respect. No one can humiliate you or make fun of you or laugh at you for your choices. People should always be attentive to you, making sure that you're as comfortable as possible during procedures and during labor. You should not be scolded or told to stop crying or told to stop making noise. Fifth, you have the right to equality, freedom from discrimination, and equitable care. This means that no one should discriminate against you because of something that they don't like about you. You should be treated respectfully, regardless of the color of your skin, language, socioeconomic status, education level, or ethnicity. Number 6, you have the right to health care and the highest attainable level of health. This means that no one can prevent you from getting the care you need during pregnancy and labor. You should be allowed to have a companion with you who can stay with you continuously. You should not be left alone in labor. Finally, number 7 is the right to liberty, autonomy, self-determination, and freedom from coercion. This means that no one can detain you or your baby without legal authority. They should not forcibly separate you from your baby against your wishes. That would be a human rights violation. You have the rights to your body and your baby. Just because you're pregnant or in labor, this does not change. Also, if for some reason you had COVID-19, that also would not change your human rights in labor. In addition to human rights, you also have legal rights, which are enshrined in law. Legal rights may vary from country to country, but in general, most countries have the ethical and legal right to informed consent and refusal to medical procedures. This means that you have the right to full and complete accurate information about your options and the freedom to say yes or no without coercion. In the U.S., there's also a very important federal law called EMTALA. This stands for Emergency Medical Treatment and Labor Act. This is a federal law that requires anyone coming to a hospital with an emergency department to be stabilized and treated, regardless of their insurance status or ability to pay. This law was enacted in 1986. Under EMTALA, every U.S. hospital with an emergency department has a duty to treat any patient who arrives in labor, caring for them at least until the delivery of the placenta after the baby is born. In other words, a hospital cannot kick you out or refuse to admit you just because they don't like a decision you've made or the way you want to labor or birth your baby. However, a hospital can tell you not to come over the phone. It's my understanding that this law only kicks in if you actually arrive at the hospital in labor. Due to the pandemic, I've already heard reports of women calling ahead before they come to the hospital in labor and being told not to come to this hospital. And then they call multiple hospitals and they're also told not to come. This means you need to be prepared for the fact that if your hospital is overwhelmed during the pandemic, they may request that you go to a different hospital. However, if you arrive there and you're in active labor, they cannot turn you away. You could say, I invoke my right under the federal EMTALA law. You cannot turn me away. I am in active labor. So now I want to do a little summary of what we've covered and also talk about some resources available to you. So in summary, when giving birth in a pandemic, the situation in hospitals can change rapidly. Keep your eye on policies about support persons for people in labor and be proactive in reaching out to politicians and hospital administrators before there are negative policies in place that ban doulas or partners or both. The truth is, until testing and personal protective equipment for nursing staff and doctors are easily accessible, expect potential changes in visitor policies, sometimes on very short notice. At the same time, remember that partners are not visitors. They are essential members of the healthcare team. Many people view doulas in the same light. If you are not permitted a support person, talk with your provider about your options. Also, talk with local doulas. Remember, there are a variety of comfort measures you can use both at home in early labor and at the hospital with or without a partner. Finally, remember that you have human and legal rights in labor. I also wanted to leave you with some resources in case you want to learn more. Our COVID-19 research page has weekly updates about the research on COVID-19 and pregnancy. We didn't go over some of that research, so I'd encourage you to check out that page to look at the research results specifically on pregnancy and infection, including info on what are the guidelines if you test positive, what are the practice guidelines and how do they differ from country to country, and also check out info on the controversy on separating mothers and babies when there is an infection or suspected infection. As a courtesy, we will also be providing a legal waiver template for parents who have a suspected COVID-19 infection or diagnosed infection, and after an informed consent discussion, refuse separation or isolation from their newborn. Also, to go along with these videos, we provided worksheets as well as a guided relaxation MP3 that you can use during pregnancy and labor, and that's available at evidencebasedbirth.com/crash course. We also have our virtual doula directory you can find on our COVID-19 resource page, where we have a team of doulas, nurses, midwives, childbirth educators, and lactation experts from around the world standing by, ready to help you if you need someone to help you navigate a difficult situation. Finally, if you want to take your learning to the next level, we do have a full comprehensive online childbirth class that is guided by an evidence-based birth instructor. We can match you with an instructor if you go to evidencebasedbirth.com/childbirth class.
So I hope you found this video helpful. I know this is a stressful time and a lot of people are feeling really anxious. But here at Evidence-Based Birth, we want to send our best wishes to you and to let you know that we are excited that you are going to be welcoming a baby to this world. Babies bring so much joy and light, even in the midst of heartbreak and sadness. So we are excited for you, and we wish you all the best as you bring this baby into the world.